Good evening, y'all. Welcome to Soulibration here on blackdoctor.org. I'm your host tonight, Shamika Rhymes. Let me know in the chat where you are watching from and how you're doing this evening. I am super excited about tonight's show. But remember to share this with your network because you never know who might need it. And if you have any questions at all tonight, y'all know you're the co host. So drop those questions in the chat. I'll be watching to see if you have any questions. So let me tell you what we're talking about tonight. Tonight, we're talking about the benefits of lymphatic drainage massage. Let me know in the chat if you've ever had one of those massages. I just had one yesterday. And it's an essential therapy for healing, circulation, and detox. Now, whether you're recovering from breast cancer surgery, breast reduction surgery, cosmetic procedures, or you simply want to boost your immune system, lymphatic drainage massage can reduce swelling, ease discomfort, and help your body restore balance. So you want to make sure you go grab a pen, pencil, take notes, pull up your notepad on your computer, whatever you got to do to take notes, because you're going to learn tonight how this gentle technique supports both your physical recovery and let me tell you all a secret. It also helps your emotional well-being. So let me introduce you to tonight's guest. Tonight's guest is Melissa Lamb. I know her personally, so I'm excited she's here. She is a licensed massage therapist and the founder of Elite Bodies of Work here in Charlotte, North Carolina. She specializes in post-op care, lymphatic drainage therapy, and body contouring support. And she's known for her clinical yet compassionate clients and approach. And she works closely with plastic surgeons to help clients recover safely and effectively. She is certified in manual lymphatic drainage and post-op body care. And y'all, she knows her stuff. And so let me bring her on stage. I see you, Gastonia. I see you, Asheville. Welcome, y'all. Hi, Melissa.
Hello.
Welcome to Soulibration. How are you?
I am very well. Glad to be here to spread a little bit of knowledge and share some information.
Well, I am so glad to have you. And y'all, let me tell you, the massage I had yesterday, Melissa did it. So, I'm very transparent. Melissa did it. An amazing experience as always. And I see you, Wallace, North Carolina. Welcome, 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 y'all. Let me know if you have ever had a lymphatic drainage massage. I'm curious. All right. So, Melissa, let's start off with can you talk about maybe, I don't know that people really even know what the lymphatic system is. Can you explain what that is?
Okay, so the lymphatic system runs hand in hand with the circulatory system. So, circulatory system moves blood back through vessels like, veins and arteries and all that good stuff back to your heart. So, your heart is the pump. Your lymphatic system has vessels as well, but you have to create the pump. So, we have different lymph nodes, and all these lymph nodes are spread throughout various areas of your body. So, the purpose of your lymphatic system is it's your body's it's good for moving toxins and waste and things that sit stagnant close to the surface of the skin that no one really knows about.
Mm-hmm.
So instead of like the heart being the pump for blood, the lymph nodes are the pump for the lymphatic system. So when they get backed up, we get sick, like colds, flus. A lot of times with your tonsils, you get a little tonsil stones. People don't realize we have lymph nodes right here. These are the submandibulars. So
Mm-hmm.
when they swell up, you feel it, and that's when those tonsils start acting crazy. Just various things that people would have never thought to tie to the lymphatic system that are right there that get overlooked.
Oh, okay. So, I see some more people checking in. A Charlotte girl living in Orlando. Hi, Connie. Welcome. I see Charlotte also checking in. Hi, Lynette. So where are our lymph nodes? I know just from having surgery, I know where some of them are located, but can you just kind of walk us through like the main ones? Well, I guess they're all very main ones,
Yeah,
but
there's some
where
that
they're
are more important
located.
than other ones. Okay, so you have the submandibulars that sit right here at your jawbone. Then you have the subclavians that sit above and below your collarbone. Then we have the axillary lymph nodes that are at your armpits. Then we have a Certina chyli of nodes that sit right here at your sternum. Then you have the deepaguinals that are at your groin. And then you have the poplitofascial lymph nodes that are on the back of your kneecaps. So it's wild that you have these lymph nodes in so many different places, but it's so that no particular area is overloaded with lymph, even though it sometimes wind up being that way.
Okay. Do we have them on our ankles too? Just because I saw a video on YouTube where they were like, when you're opening up those lymph nodes, they were doing it on their ankles.
Well, it's because, okay, lymph is always looking for a low place to sit.
Okay.
So, being that your feet are at the bottom of your body and they're taking on, most of the pressure from us walking, lymph tends to sit on our ankles. That's why people who work in healthcare or do a lot of standing tend to wear compression socks so that lymph doesn't sit on their ankles, is redirected back up.
Gotcha. Okay. So that brings us to the next question. What is lymphatic drainage massage and how does it support overall healing?
Okay, so lymphatic drainage massages are essentially where you're waking up and pumping these lymph nodes, because like you have to create a pump like motion to wake them up so that they can flush these fluids that your body's holding out of your system. So lymphatic drainage is good for everyone because we all walk around with certain lymphatic stagnations. So if you've had surgery, whether it's from being put under the tumescent fluid still being in your system sometimes, because some people claim they deal with a little bit of issue with the anesthesia, like a little bit of brain fog, slower cognition, just having a harder time getting back to themselves. It's because some of that stuff is still in your lymphatic system. So us getting that stuff to flow and move, you start getting back to yourself. That's why I tell people after these massages, you notice your urine smells different. Going to number 2 is going to be way more of it and it's going to smell different. So there's that benefit to it. And a lot of people who tend to have weaker immune systems really benefit from it as well, because those stagnations that are making um, your immune system move slower are now flushing back out. It's like sweeping a house and you're realizing just how dirty the floor was.
Well, how long? I'm just curious. How long does that anesthesia stay? Because I'm 3 months post op and I'm still tired.
Now,
So,
see, that may not be from the anesthesia. That's from people wanting to get back to their norm and moving too fast and doing too much too soon. And your body's like, okay, all right, you want to rush me? Watch this. You rush me, so now I'm going to slow down. So
mhm.
that's a whole different animal. It's a whole
That's another
different
discussion.
situation. Yes.
Well, we won't. Let's skip past that because we won't talk about that.
Yeah. You see, I was like,
Well, how is this lymphatic drainage massage very different, or is it different from like traditional massages? Because I'm sure you guys in the chat, let me know. Have you ever just gone for a massage? Because I know for me, I've gone to regular massages, so this was a lot different
mhm.
for me. So, can you talk about the difference?
Okay, so the difference is a few, different things to it. A traditional Swedish massage is just more for relaxation, just, where they're just, more so relaxing the body. It's not like they're
Hmm.
looking for deep tissue. So if you come in with knots, a Swedish massage is not going to do anything for that. Swedish is strictly
Right.
for relaxation. Deep tissue massages are for, when we're like, let's say you come in, you got this knot in your shoulder. Okay, deep tissue is where they're going to get in there and really break that down, right?
Hmm.
Okay, so those two have their purpose. Now, a lymphatic drainage massage is the purpose of a lymphatic drainage massage is to wake systems up. So it's usually a featherweight touch, and we're moving lymph. So imagine two pieces of paper, your skin and then the lymphatic system being right below there. So it's the second piece of paper. So it's very light because if you apply too much pressure, you'll miss the whole system.
Hmm.
So that lymphatic drainage massage, I'm not going to take anything away from the Swedish or the deep tissue. They serve their own purpose. But the lymphatic drainage massage for me has been more purposeful, only
Hmm.
because I'm watching people's body change as I'm doing these techniques. When I work with people that are coming in immediately after surgery, you can literally hear the fluid moving below the surface of their skin.
Yes.
So knowing that I'm redirecting this fluid to lymph nodes and I'm watching the body like take it on. And it's been multiple times where during the session, people are like, hey, you got to stop. I need to go to the bathroom.
Hmm.
And for me to know, okay, come back. And they're like, oh, I feel so much lighter. I feel freer. Like I have much
Hmm.
better range of motion. And again, that's why I say not taking away from those other two techniques, but that is very fulfilling because I know like that same day before you walk out of my office, you're not the person that walked into my office. You're going to notice a difference, whether it's physical or mental, usually both. But
let me tell y'all, the first time I laid on Melissa's table, I was telling all my business, and I don't know if it moves emotions and everything else too. That was the first time I met her, and I was like, girl, I don't know where all this came from.
well, then too, I mean, randomly enough, a lot of times we have trapped emotions and they're sitting there like, oh, my turn. Okay, bloop. And I'm sitting here like, go ahead, do what you need to do. All right, safe space. That ain't going nowhere. So, it's just exciting to me that I can help people along their journey in several different ways because I'm not just working on the surface of your skin.
Mm-hmm.
We go to the mirror and I want you to look at yourself. Like, I want you to look at this mirror because most of the time in our mirrors at home, we're not saying nice things to ourselves. So, this mirror is the biggest, brightest mirror I could find. And I want you to tell me what you see because that's why I say it's more than just physical. The
Mm-hmm.
things you tell yourself are what actually show up in your body. Like the things we don't like, okay, you're going to get more of the things you don't like. So, one of my other goals is to get you to see what's actually there, not what those mean voices are telling you. And so that's where a little bit of body dysmorphia comes into play. Like, it'll be a totally different situation. Like in this mirror, you see, oh my gosh, this stomach looks crazy and all this stuff. But I'm looking in the mirror like, are we looking at the same person? Like, what do you see?
Yeah.
So that's why I say it's physical and mental. I want to make sure that you walk out with a better idea of who you're looking at and what this body's actually doing.
Mm-hmm. Yeah, and I can attest to the hearing the fluid because I was like, "What is that noise?" And the popping and crackling and the all the yeah, it is. I don't know if y'all have ever experienced that. Let me know in the chat. Have you ever had that experience where you've heard the fluid moving through your body like that? And I do see, um, I let's see, Monique says she's had a deep tissue massage, but not a lymphatic drainage massage. Um, yeah, so I think the misconception, though, sometimes, and you tell me, is that lymphatic drainage massages is just for people that had surgery.
All the time. That connotation is very like I'm just like, ugh. Okay, so let's say you look at a place like, a Massage Envy or a Hand and Stone. People have memberships, and these people who haven't had any surgery, right? Okay,
Hmm.
so this is for relaxation. Your lymphatic system carries all this stuff through your body. You're walking around swollen and inflamed and don't even know it. Like you think it's your norm, right?
Hmm.
So you look at your ankles, like my ankles are puffy, or, look at my arms, like, oh, my arms are swollen, or I got this chin going, not
Hmm.
knowing that that's not fat. That's fluid that needs to be redirected. So where I am now is I want more people to look at themselves like, okay, self care is not selfish. And these massages are actually life changing in a lot of cases because you're like, wow, I thought my arms were just hanging in fat, but it was
Hmm.
fluid that needed to be moved back to those lymph nodes because your arms hang down. So fluid will go down your wrist. And a lot of people will notice that their rings fit different, their watches fit different, like everything just, wow, what happened? We
Hmm.
moved that fluid. So, yes, being able to do that for people and watch them go back to that same mirror after that session and see a difference
Hmm.
is like pretty mind blowing because I just stand in the corner, like, go ahead, look in the mirror. And they're like, what? Was this some sort of skinny massage? I'm like,
Let's see. We've got a question. Let me see if I can get this up here. Will that work? Oh, it did work. Okay. Sorry, y'all. I'm also producing. But Monique says since lymphatic drainage massage is not a standard weight loss solution and primarily provides that temporary slimming effect, what are your thoughts on people using it as a cosmetic boost?
okay. So I guess essentially what she's saying is when some people call it the skinny massage, it's not necessarily to say that it's temporary. There needs to be lifestyle changes that take place afterwards because it's not a one time thing. All this fluid didn't build up over one time. Like it's not like you went out on Saturday and, was drinking, alcohol or walking around dehydrated, eating a bunch of bread, pasta, having bad habits as far as not taking care of yourself are concerned. These are
Hmm.
things that built up over time. So to someone who comes in one time, yes, it's going to seem temporary because we redirected fluid, we woke it up, but you're not doing anything to continue the flushing process. That's why after the massage, I tell people, okay, I'm going to give you a dry brush and I'm going to tell you how I want you to use it so that you can continue moving lymph throughout,
Hmm.
from here on out. Like, okay, even what you're drinking, people think that just drinking water is going to hydrate you on a cellular level. No, that's why if you're just drinking plain water, you notice you immediately have to go to the bathroom. That's why I incorporate, okay, watermelon juice, coconut water, cucumber water. These give you H3O2. So it hydrates you on a cellular level. So you'll drink that and notice that you don't have to go to the bathroom because you've given your body what it actually needed. So I'm not going to say it's temporary. It's just things that need to take place afterwards. Now, if you have an event and you got this dress that may fit a little tight, yes, you come and get that lymphatic drainage massage and we'll do a facial as well, and you will notice an immediate difference. But if you want those results to continue, you're going to have to stay on top of your hydration. You're going to have to start incorporating some lymphatic dry brushing. And people usually want to set up multiple sessions, but there have to be lifestyle changes. It's like you went and got a new car and you're not willing to do the maintenance.
Hmm.
So, what do you think is going to happen? There's certain things that have to take place for anything to be more successful. Anything you do is going to be things that take place afterwards. So that's why people will think, oh, it's just a one-time thing. But I incorporate body contouring into my lymphatics as well. So yes, the lymphatics will, if you come in one time and you don't make changes afterwards, yes, it'll be very short-lived, very
Hmm.
temporary. But if you come in and you listen to some of the things that I need you to incorporate, this can be a long lasting, like permanent change. I have a lot of people who are getting into weight loss and
Hmm.
they're in the gym and they're inflamed. So us being able to move that fluid back through your system, okay, wow, I see more of those abs. Okay, the body contouring. Okay, I've got better range of motion. I'm not as sore when I went to the gym the next time. And just all these benefits if you're willing to do your part.
Hmm. Y'all, I saw abs yesterday. I saw abs.
Yes, I did too.
Let's see. Let's see. And I'm sorry. I think her name is Ty Monique. I just pronounced it wrong. I'm sorry if that is how you say your name. She says, also, do you believe this type of massage should be paired with practices like intermittent fasting, exercise such as Pilates or body wraps to get the max results for someone using it for cosmetic reasons?
Okay, ma'am, I'm going to say one thing. I don't even want to say it's cosmetic. It's to make you feel better about what you see in that mirror. That's not cosmetic. That's self-love. And for people who are coming in that haven't had a surgical procedure and they're like, I just want to feel better about what I'm doing because I feel like I plateaued or I'm not seeing the results that I was looking for. So you can work out, and working out creates inflammation. So you'll swell up before you start to really see a difference. So people think, oh, I'm not seeing any changes. The scale isn't moving. I'm not really seeing a difference in my inches. But then you come in and I start manipulating some of that fascia, start releasing some of that scar tissue. So now when you were doing those 5 Bulgarian, whatever you're doing, you can now do 10. And your range of motion is better. So those squats, you're going deeper in those squats, you're seeing more of a benefit to everything you're doing, because everything that was pulling you back as far as your lymphatic system, as far as scar tissue, because in order for muscles to grow they have to rip. So that creates more inflammation. So us releasing that stuff has been a real game changer. Like, I used to work in a gym and some of the clients would be like so much happier because they're like, wow, I'm not as sore after my workouts, and I'm going deeper into everything that I'm doing faster, and that swelling that I knew was coming on, I don't have it now. So it's exciting to see changes from all angles, so anyone can benefit from these services.
Absolutely. Let's see. Oh, hey, Iris. She says she was on your table this morning and she heard the pop, pop, pop. And it's amazing how you look when you get up from the table. Melissa's the best. Love her. That's a great compliment.
So the pop, pop, pop that she's speaking of is, okay. So let's say we're working on cellulite, and as I'm manipulating that, and there's this fascia has these bands, and you're manipulating those bands to smooth these areas out. You hear it releasing, and it's a sound. To me, it sounds like, let's say somebody's got some cornflakes and you hear somebody crunching them. Like, I just hear this little popping sound and a release, and
Mhm,
it's like all the fascia smooths down, and then you start feeling the person stretching more, and you see the
mhm.
difference in the shape and the contour. So it's just exciting to see these bodies change in front of not just me, but the person, because they go back to the mirror, they're like, what did you do?
Yeah. Yeah. Yeah, and remember, I told you guys last week during last week's show I had a breast reduction, and so when I went to Melissa, I still didn't have range of motion with my arm. I could probably get it here because after the breast reduction surgery, you're T-Rex, so you're not able to lift your arms. But y'all, I would lift it now, but my whole outfit might get messed up. But now I can lift my arms all the way up, and I heard that noise because I was like, and you were like, "That's you."
Because everyone thinks it's my gloves. I'm like, that is not my gloves. And like as I'm releasing the ribs, like letting all that stuff out, and then I tell everybody, okay, let's start some good diaphragmatic breathing. Like start breathing, like don't hold your breath. And I can
Mhm.
understand the urge to want to hold your breath. You're like, oh, that's a little spicy, and it
Yeah.
is. But then it's like it gets better as time passes because I'm releasing all that tightness. So it's
Mhm.
exciting to see all those changes. Like even when you were talking about the arm, that's why I have people when they go on their side, I have you bring your arm here so I can see all those bands because they tend to either pull from the rib or from the hip. So being able to release that, game changer.
Mhm. Let's since it is Breast Cancer Awareness Month, I wanted to ask specifically, how can a massage like this help women recovering from breast cancer surgeries, whether it's a mastectomy or reconstruction, or even if they just have the lumpectomy?
Okay. So usually I always tell everybody wait until your doctor has cleared you because I want to make sure that any lymph nodes, because usually whenever there's been some form of cancer, and this is another thing that I want to make sure people understand, usually when there's been some form of cancer, lymph nodes from that particular area have been removed. So
Mhm.
that should spark people's interest as far as, wow, if they're taking lymph nodes, there's got to be some level of importance to this lymphatic system. So essentially, what we wind up doing is redirecting fluid towards other lymph nodes, depending on how many lymph nodes were removed in that particular area. Because sometimes women will wind up with either lipedema or lymphedema in that area because the other lymph nodes are completely engorged and inflamed. So now, like whatever limb, whatever area where the cancer was and those nodes were removed, we need to redirect that fluid back out of that area. So it tends to be the left arm, like, okay, if it was whichever side it was on, that arm tends to get more firm. They lose range of motion. So we
Mhm.
start with a little bit of bandaging and, redirecting that fluid up. And if these nodes are gone, we'll either move it up here or we'll take it down to other nodes, just so you don't have that stagnation in that specific area.
Okay. Let's see. Ty Monique has another question. She says, "Is lymphatic drainage massage for someone with chronic illnesses like congestive heart failure, kidney disorders, deep vein thrombos? I'm gonna get it out, y'all. DVT, hypertension, and diabetes."
Okay, so those tend to be ailments that, all right, so congestive heart failure means the heart's not pumping like it's supposed to. So people tend to be way more inflamed there. And us doing lymphatic drainage may put a little too much pressure on the heart just
Okay.
because, it's already got an overabundance of fluid here. And although that most lymph does not go to the heart, we don't want to put more pressure on the heart. Kidney disorders, the kidneys tend to be one of the body's biggest filters. So if the kidneys are already in distress, we tend to avoid massage that will make them, work harder to flush stuff out. And deep vein thrombosis, we tend to avoid that just because sometimes that involves blood clots.
Yeah.
So some people still do the techniques, just not on that particular area. And as far as diabetes is concerned, it depends on if it's type 1 or type 2. And across the board, it needs to be controlled. So I tell people with those conditions, it has to be under doctor's approval just because I don't want to risk, doing you any harm.
Hmm. Okay. So I do have a question. I won't be able to put it on the screen because it's on my phone.
Okay.
um, Tommy from Asheville wants to know, does this work for someone with neuropathy?
Okay, so neuropathy tends to be where you've got nerve damage, and sometimes, there may be inflammation in that particular area. So again, as long as your doctor approves it, we can redirect fluid from that area because sometimes that may trigger the nerves to wake up and start, doing what they're supposed to do again. It's a case by case thing. So if you come across a therapist up your way, ask them and see what they tell you. It can be helpful, but always move under your doctor's approval.
Absolutely. So You guys are asking some great questions tonight, and continue to put them in the chat if you have more. So I wanted to go back to cosmetic procedures such as liposuction, tummy tucks, breast reduction, um, all the things that fall up under cosmetic procedures. What results can patients expect with lymphatic drainage?
Okay, so it's quite a few things. So people think that they'll go and have surgery, they're gonna wake up the next day and they'll be snatched. No, you wake up swollen. You woke up very swollen. You're uncomfortable, you're
Very,
disoriented, and you're looking at a body that you don't recognize. Like most people come in, they're like, man, I'm bigger now than I was before surgery. Like, what is this? And
yeah.
essentially it's trauma to the body. So these massages make such a difference because we are redirecting fluid back to your lymphatic system, because essentially after surgery you wake up and everything's like on pause. So we're waking things up. You wake
Hmm.
up, you're very disoriented. Sometimes people wind up staying a little bit longer or with a catheter because it's like, okay, your systems are still asleep. So as these systems wake up, your brain is telling you, okay, we awake, let's go. No, you've got all this stuff in your system, you're disoriented, you're not yourself. So now you come in and you get these massages, and we start redirecting that fluid. And now, okay, everything that was super swollen is not so swollen now. That
Mm,
range of motion where you were just like, oh, I can't move my arms. Okay, now you can move your arms better. Okay, so procedurally based, everything just starts to shift in a better direction. So I've had people come in and they walk in all hunched over, just like miserable. And when they
mhm,
leave, they're like, listen, I'm standing up straighter. I feel lighter. I went to the bathroom 2 or 3 times and it
mhm.
smells different because you're smelling that medicine coming out of your system, and your lymphatic system is pushing fluid back through as well, and you start to get back to feeling like yourself, which is what people truly want, because most people go into surgery without knowing that, okay, you're going to wake up, you're not really going to be yourself for a little bit.
Yeah.
So you coming in here and me being able to inform you on, okay, this is what's happening, this is why you feel that way, and we're going to make sure you have this in your garment, we're going to do these steps to get you back to normal. Game changer.
So what are your thoughts on, I mean, like, for example, my surgeon did not recommend me doing lymphatic drainage massages until I didn't get the go ahead till after the 3 month mark.
Mm-hmm.
Whereas some people get, say, their doctor said, go, like, they have surgery on a Monday, go Tuesday. So
Mm-hmm.
what are your thoughts on that? Does it matter when someone comes?
It absolutely matters when someone comes. Um, a lot of surgeons will tell you to wait because they've either had a bad experience with an untrained person, or they don't know anybody personally, so they don't want to risk vouching. And then you go and it's like, oh, they messed me up and I only went to them because of you. And so it puts the liability
Yeah.
back on the surgeon. So the people who I work with that tell people, hey, you can go the same week, you can go the next day, go whenever you're comfortable. I built that relationship with them. So me
Hmm.
going in their office and educating them on exactly what lymphatic drainage techniques are, and making sure they understand that, okay, I'm your second set of eyes. People don't usually go back for their follow-up visit until a week post-op. A lot of things can happen in 7 days. So having a properly trained therapist can change the whole trajectory of someone's results. So imagine you come in and you know your garment isn't properly packed and you've got overlapping, you've got bunching. I fixed that. So the changes that are made are like worth it. And now the doctors understand. So I've had a lot of doctors that met me because their patient came back in looking completely different from what they expected. Less swelling, less bruising, much less downtime. So being able to do that, game changer.
Hmm. Let's see. Hold on, let me pull this up here. For non-surgical clients, what are some common side effects for someone like Monique? She's just wanting to use it for wellness and to reduce the appearance of cellulite and body contouring. And she's asking if the side effects are a little bit milder.
Very good question. So for non-surgical clients, essentially some people feel like they have a little cold, or they're just a little fluish because we've stirred up toxins that have been sitting in your body. So
Mm-hmm.
you're gonna feel like a little like sluggish, but that's why I tell everybody make sure you hydrate, because it's like we're
Yeah.
doing an oil change. You have to put fresh oil in to flush all this oil out. So some people are a little sore because I don't just do lymphatics. I do body contouring with my lymphatics,
Mhm.
especially on my non-surgical people. So it incorporates other techniques. So whether it's wood therapy, cavitation, skin tightening, and dermal treatments, ice therapy, it's going to be a little more aggressive because it's a whole different situation. It's a whole different set of results. So soreness, some people have a slight headache sometimes, but it all depends on how you hydrate. Your hydration and making sure you avoid salt, red rice, and pasta, anything that's going to bloat you immediately after is going to determine what your side effects are. But for the most part, a little soreness and maybe a slight headache, depending on how many toxins we've stirred up. So it
Mhm.
depends on what you bring me.
Okay. And I'm glad Valeria is asking this question because I meant to ask you this yesterday. Can you elaborate a little more on dry brushing, the benefits, and how to do it? I should have brought my brush up here to so we
Okay,
could walk through
very
it.
good question. So what I'm going to do, I'm going to make another video because the lymphatic system, when you're dry brushing, it exfoliates the skin, increases blood flow, increases lymphatic movement, and it's really good for bruising as well. Typically for my people who just had surgery, they come in very itchy. And it's because, the bruising is right below the surface of the skin.
Mhm.
And, all it is broken capillaries right below the surface of the skin. So the bruises look crazy to start with. So what dry brushing truly does is it's a light stimulus for the lymphatic system. And I really like it for people to do it at home between appointments to continue the lymph flow. So if you're brushing your legs or your arms, you're always going to go upwards just because you're moving fluid that was going to sit at a low point back up.
Mhm.
As far as your stomach is concerned, I appreciate clockwise circles. And then, you're going to move it down to those deep inguinals at your groin. And, if you're doing anything above your navel, you're going to bring it up to those axillaries, or you're going to make sure you flush that Cercina chyli at the center of your stomach. And you're going to want to make sure that you brush up here because the termini, these are the big lymph nodes, the subclavians. So the right side over here drains a soda can worth of fluid. So it drains your head, your face, your neck, and your right breast. So about a soda can worth of fluid moves through this side. The left side drains the rest of your body. So it's about a gallon worth of fluid that moves through this side.
Wow.
So when you're dry brushing, the first thing you want to do is hit them with the spot fingers and go above and below those collarbones. So we'll have a whole video on that just because you've got this whole body that needs to
Hmm.
be brushed. So that's why I say if you're brushing your legs, always brush them up to the groin. Make sure you hit those lymph nodes on the back of the knees. With your arms, you're going to want to brush down because so many people think this is fat and it's fluid. It just needs to be redirected. So brushing the arms downward. And even if you don't use a
Wow.
brush, you want to use your hands. You can just dry like before the shower. You can just use your hands to bring everything down. Just make sure that you start here because it's imagine you're getting on a highway and the merge lanes or the exits are blocked. That's what these are. So if you want everything to flow, you're going to want to start here and then go everywhere else you need to go. But we'll make a video for that.
Okay, thank you. Because you know, so this chin right here ain't fat. It's
Mm-hmm.
it's just fluid. That's what I'm going with.
Yeah.
So it's fluid. So
Mm-hmm.
how do I get this part to drain? Is it just
Okay.
another do I use the brush or do you I mean, and even the puffy under eyes, like all
Mm-hmm.
that. What do we do for
Okay,
those
so a lot
things?
of times through here is stagnations of the liver when we're not hydrated like we're supposed to, but it's also seasonal allergies and things of that nature, like the positions we sleep in. Like I have a lot of stomach sleepers, and they come in there like, but their face is very much congested. Side sleepers tend to be congested on one side or the other side, and my back sleepers tend to have better lymph drainage.
Mm.
So essentially right here, this puffiness, you're going to want to start by lightly bringing that down to these lymph nodes, light. Like you're not pulling the skin, you're just lightly redirecting it, but just making sure that you start by pumping these lymph nodes. So it'll be, you'll feel them. It feels like pebbles. So circles, then a light pump to open those lymph nodes up, and then crossing over and opening these lymph nodes up. So we
Uh,
have a whole facial lymphatic drainage technique, and those facials are game changing. Like I try to do them on myself 2 or 3 times a week, and we call it facial gymnastics because when people come in, it's a whole procedure.
mm,
So yes, I have a technique for the body, but then one for the face because we have a whole lot of lymph nodes throughout your whole face. I mean, even for people who are complaining about those 11s, we can redirect that fluid in this area right here. We move the fluid out of there. So it It's not what people think it is. People think, oh, my face is getting fat. No, it's fluid. If you realize that this is the low point, the same way I talk about your hands hanging, your chin is the low point of your face. So that's where stuff likes to sit. And you have to remember we have teeth here too. So when they hold toxins, guess what? It drops right here as well.
Hmm.
So everything drains down here. So people who deal with ear infections, they deal with a lot of lymphatic drainage issues as well. So yeah, it's just a matter of figuring out what you have going on and how it needs to be addressed.
Okay. Woo. Yeah, I might have to sign up for that next.
I got you.
I need that next. So, which brings me to my next question. What does a typical lymphatic drainage session cost? And is it covered by insurance or could it be covered by insurance? How does that work?
Okay, so our sessions are 195, and time wise, they're about an hour to sometimes an hour and 15 minutes. I say an hour and 15 minutes because people who've had surgery, I tend to have to help them get back into their garments and make sure they're properly educated on where things need to be placed at. Um,
Hmm.
let's see, you asked me how much, how long. What was the third part of your question?
Does insurance can insurance pay for it, especially if it's part of a surgical thing, a post-op thing?
Well, we accept FSA, HSA, Cherry, Klarna, and Afterpay. We haven't really gotten into the realm of insurance just because that can be a little tricky.
Mhm.
So, yes, those are the things we currently accept.
Okay. And I see a lot of questions, people wanting to know where you're located, because they may have just been joining us, so they may have missed when I said that at the beginning. So can you just go ahead and mention where you're located?
Okay, so we are off of Pineville Matthews, and we if you're familiar with Charlotte, we're beside Charlotte Latin, behind the Wells Fargo. So it's 7731 Little Avenue, Charlotte, North Carolina 28226. We're not too far away from Carolina Place Mall, and we're not too far away from the new Publix off of Pineville Matthews.
Okay, thank you. So yes, y'all, she's in Charlotte, North Carolina, because I know some people are watching from different places.
Hmm.
Let's see. We have another question about something you just mentioned about the teeth and the mouth area, how it can hold lymph. Do you integrate? I'm gonna tear that word up, so I'm sure you
Buccal.
can see it. Yes. Do you
Hmm.
incorporate that?
I can. Um, Buccal is a very personal massage because we're literally in your mouth. I have a few people who I've done it with via gloves. A lot of people who have TMJ, and to
Uh,
be able to release that masseter muscle has been very helpful for them. But being able to also work within that jaw and contour that jawline is how the buccal massage really does come into play. So we're working that whole muscle and then cleaning up this area as well. So yeah, it's very effective, but it's just one of those techniques where you're just like, oh, okay, this is really personal. All right, you just in my mouth, just all right.
Valeria, I agree. The Elite Bodies of Work office is beautifully decorated. So, what qualities or credentials should somebody be looking for when choosing a provider or post-op, for their post-op or just a regular lymphatic drainage massage? If they whether or not they had surgery or not, what should they be looking for?
Okay, so the first thing they should look for is to make sure that they are a licensed massage therapist. I know of some estheticians who do some facial lymphatics, but starting with, for me, the massage license.
Mhm.
Then you want to see if they have any certifications in lymphatic drainage. It's a few places and it's a few different styles that people can learn, but foundational wise, make sure they're actually a therapist that's well versed. So
Mhm.
I'm a licensed massage therapist. I'm also certified in several different post-op techniques: manual lymphatic drainage, the body contouring techniques, the wood therapy techniques, the ice therapy techniques, the endermo techniques, and various things. But deadline minimum, a massage therapist, and then some certifications in some form of lymphatic drainage, whether it's Chickley, Norton, Klaus, or Votter. Those are going to
Okay.
be the four main ones that you're going to look for. So,
Okay. And I did want to go back really quick before I know we got about 5 minutes. So if you guys have any more questions, please drop it in the chat. I wanted to touch on this really quick because a lot of women are now getting BBLs, Brazilian butt lifts. How does lymphatic drainage support that?
okay. So as far as the BBL is concerned, the Brazilian butt lift, we don't work directly over the area where fat's been grafted to. So we don't work on the actual butt. We don't work on the glutes. Whenever someone's had a BBL, there's been some form of lipo, whether it's 360 lipo, and that's, the whole torso from front to spine, from navel to spine,
Mhm.
or if it was arm lipo or thigh lipo, we target the areas that were lipoed. We don't mess with the areas of where fat's been transferred to. So with them, it's just a matter of making sure, okay, your lower back is swollen. We want to contour that out because then you'll see the top part of the butt. We want to make sure we take the waistline in because then, you see the silhouette. As
Mhm.
far as the stomach is concerned, we're going to want to make sure that we move all that fluid out so that you see the whole 360 shape. The glutes don't get touched unless there's like a contour irregular that needs to be addressed. Like, let's say the garment they're wearing was ill fitting. I may put tape in that area to help, with smoothing out the contour. Or with surgeon approval, I'm like, hey, there's a obvious dent here. Is this something that
Mhm.
you'd like me to help smooth out? Because there are certain instances where I will lightly manipulate only under doctor supervision. So we don't
Okay.
do anything to the butt. That area remains untouched. It's just everything else.
Okay. Let's see. We got one more question here. How often do you recommend these massages?
Okay, so whenever I have someone who's just getting started, I tend to want them to come in. Like, let's say you're coming in and you haven't had any surgery. I'll say once a week for a month, just so that we can get everything going. Because you're coming in, you've never had one, so you are a fresh canvas. I need to figure out where your stagnations are, and now let's get them moving.
Mhm.
Okay, so if someone's had surgery, depending on the procedure and how soon the doctor lets them come in, I like to see them maybe 3 times the first week because I am really shaping, molding, and contouring. Like, it's a very light technique, but now it's like, okay, let's redirect this fluid in the direction you want it to go in. Like, if they're holding at the bottom of their stomach, I'm moving that fluid out of that area. If they're holding on their flanks, I'm moving the fluid out of that area. The goal is always to move fluid to lymph nodes.
Mhm.
So that first week, 3 times, possibly 2 or 3 times the second week, depending on how your recovery is going. Third week, maybe 1 or 2 times, again, depending on how your recovery is going. Fourth week once, fifth week once. We may skip the 6th week and we start spacing them out based on how your body's responding.
Mhm. Okay. Oh, let's see. We do have a comment from Iris, but it looks like it's from someone named Kathy. My recovery after a wreck was facilitated after the lymphatic massage. The bruises and hematoma I had began to fade quicker after my lymphatic massage. So Kathy says, thank you.
Ever so welcome. Was so happy to help. I mean, I love it when my knowledge and, those all the years of learning things, I'm able to boom, pass solid information over. And it's exciting, especially when it's someone you love, even
Mhm.
more so because it's like, oh, well, now you get to see what I do. And you see how effective it is. It's like, oh, I got a little pep in my step. Okay, what you thought? I was just, no, no. It's very effective and it's exciting to see the changes.
So where can people find? Gosh, you're gonna have to come back because we had a lot of good questions, and I didn't even get to all my other questions. But where can people find more information about you? I know you've got the website right there on under your name.
Yes.
You guys see that elitebodiesofwork.com. But where else can they find you on social media?
Okay, so on Facebook, it's either the Elite Bodies of Work page or it's a page named Missy Lamb. On Instagram, it is Melissa underscore Elite Bodies of Work or Elite Bodies of Work. On TikTok, it's EBO, so EBOW. So it's just the initials for Elite Bodies of Work. And you can
Okay.
also call us or text us at 980-585-6878. That is Iris's area of expertise. She has been so helpful in, getting information out. And I really appreciate everything she does. She's been an intricate part in us being where we are.
Hmm. Yes, poor Iris. I'm always asking questions. So shout out to Iris. She
Because
probably
she
like
comes
she
straight
asked
to
the
me.
whole thing. Well, for my last question, I ask all my guests this question. What feeds your soul?
Mm, that is a very good question. Um, My soul is now being fed by the relationship that I'm building with God. We start there for me now. All before, I was all over the place. I didn't really have a set answer to that. But since I have been growing that, everything has been falling in line. Like, I'm no longer in my way. It was always me in the way, thinking
Mhm.
that things were supposed to be going a certain way at a certain time and all these other things. It's like, all right, I'm gonna sit and watch you. And when you're ready, I'm here. So
Mhm.
now that I'm actually listening and paying attention and being present and intentional, everything is falling into place. All the stuff that I wanted to do but couldn't do because I was rushing in the wrong directions or just trying to do too much, everything is aligning better than I could have ever expected it to. So that relationship has been the most important thing to feeding this soul.
Oh, I love that. I love that. I do see some comments that they wish you were in other states. Ty Monique says, I wish you were in Georgia, but I appreciate the session and the
Ah,
responses.
well, you know
Come
what?
on, come
If
on
you
up
send us a
here.
message, we there may be some people that I know down that area because I'm linked in with a lot of therapists all over the place. But if you ever come to Charlotte, North Carolina, I'm not hard to find. I'll also be teaching before long, so I'm working on my instructor's license so that I can actually travel and educate the masses because a lot of people want to do better, they just don't know where to start. So they're taking these courses, hoping that they're getting them from valid instructors, and sometimes they are, and sometimes they aren't. And I deal with a lot of people who have been going to sometimes they aren't.
Yeah, yeah,
So
yeah. I agree with Valeria Sutton. It's worth the trip. Please come on up here, Ty Monique. Come on.
I'm not far away, and I will make it worth your drive. I promise.
You will. Yes. Yes. Okay. Thank you so much for coming on and sharing with us because I know this was so educational, so helpful because I know a lot of us probably think that lymphatic drainage massages are just for people that had surgery. So it's helpful to know, the ins and outs and what we can be doing at home on our own as well, like with the dry brushing and I'll be waiting for the video. So don't you forget to post that.
Oh, absolutely not. And if you go on the page, there's a video of one of our lymphatic drainage facials, like one I did on myself. So we'll be
Mhm.
continuing to push out more information. And anytime you're ready to have me back on, I'm ready to be here.
Okay, all right. Well, y'all, for more information on lymphatic drainage massages and any of the other types of massages we mentioned tonight, you can head over to blackdoctor.org for more articles and resources over there. But coming up on Soulibration, we're switching gears and we're talking about dating. Y'all know that's my favorite topic. People love to say that the dating pool is complicated, full of rules, especially with social media coming up with a new rule every day. But what does dating really look like? Is there actually a technique, or do we just figure it out as we go along? Or did your mom and them ever teach you how to date? So we're going to dig into that next week. So join me at 7 o'clock on Wednesday, right here on blackdoctor.org, and we're going to talk all about it. I hope you all have a soul filled rest of the week. Thank you again, Melissa, for joining me. And shout out to the co host. Y'all did that tonight. So thank y'all for all
Yes,
the
they
amazing
did.
questions. Okay. Have a good night, y'all. Don't hang up, Melissa.
Yes, ma'am.